So what's unique about the piriformis here is that it's characterized by quite a few different types of pain, and I'll have a long list of them here coming up. But it can be in the hip, it can be in the coccyx, it can be in the buttock or the glute itself, the groin, portions of the leg. The sacral plexus is involved with this here, and so we end up with issues relative to it overlapping with neurological types of findings. But the piriformis syndrome can have neurologic entrapment issues, but by and large, it tends to be more of the actual muscle itself. This causes signs and symptoms of sciatic nerve distribution without involving the sciatic nerve, but then you can have that involved, as I mentioned. But then you see gluteal area, posterior thigh, posterior leg, and then the lateral aspect of the foot when you do have the entrapment. And that's when it becomes a little bit more serious and you have to start to consider more aggressive ways of actually stretching and going after why we have this facilitation issue within the piriformis. And as you look here, the myotogenous or the muscular pain distribution is very unique in that it's along the lateral aspect of the sacrum, right where the origin point is, and then we go into the insertion point around the greater trochanter. So it does tend to be rather sclerotogenous, myotogenous, and you can see sort of the scatter plot or the heat map of the redness here in the artistic rendition. They've done a good job with it. It shows how you can actually have a a referral of the pain down the leg. But then if you do actually have any kind of entrapment component here, which I'll show you here on the next slide, you end up with issues relative to neuropathy.